All right. Welcome back, everybody. Thank you for tuning in. Today, I'm going to be giving a presentation on breaking down shin splints. Here in New York, we're currently in the midst of a spring football season, and we've got a bunch of other sports beginning and overlapping as well. So, a lot of shin splint complaints have been coming in, and it was a perfect time to kind of give an educational presentation and break them down for you guys. So, like everything, I like to start with the anatomy of the chief complaint. So, with the shin, we're looking at our two main bones are our tibia and our fibula. Our posterior musculature, or the muscles that lie in the back of the leg, lower leg, are your gastrocnemius and your soleus. You've got a few muscles in the front that make up the shin muscles. Your main primary mover is the anterior tibialis. And then your other two are the extensor digitorum and the extensor hallucis longus. Extensor digitorum is responsible for extending the toes, and extensor hallucis longus is responsible for extending the great toe or the big toe, and both of them perform dorsiflexion as well. Some important other structures, in this case, connective tissue is the extensor retinaculum. It's a thick, kind of fibrous ribbon that wraps around the ankle and connects the foot to the lower leg. So now that we know the anatomy, here's a picture of those structures. We're looking at basically our tibialis anterior muscle here, extensor digitorum. And here is that fibrous ribbon-like retinaculum that I was describing earlier. And this is the motion of dorsiflexion. So if the toe is pointed or the foot is pointed, raising the foot towards the shin is dorsiflexion, okay? Over here we have the posterior musculature. This is the gastrocnemius. It has two heads to it. The lateral head of the gastroc, the medial head of the gastroc. This is the area known commonly as the musculotendinous junction, and this would be the Achilles tendon here, which inserts down on the calcaneus bone. So causes of shin splints, basically, these are the main causes. Okay, so increase in body mass, and this could be adipose tissue, skeletal muscle mass, lean muscle mass. Could be bone density, or in a lot of cases too that some people forget, it could be equipment. So, your football, lacrosse, hockey, things of that nature. If it's a more of a military or outside of sports concern or case, we're looking at rucksacks and backpacking trips. So external forces and external load basically is definitely something that the musculature and the structures of the lower leg aren't acclimated to yet. So when we get into how to correct shin splints, we're going to get into an acclimation phase to be able to handle that load, that external load. Another cause would be muscle imbalance or muscular imbalance. This is the one we focus primarily on in our rehabs or rehabilitation, where we have a tight posterior chain and a weak anterior chain or anterior musculature. So we will get into that I think on the next slide. Also, structural integrity. So this would be a case where whether you are flat-footed or high-arched, the construction of the arch of the foot is responsible for dispersing forces and sending those forces up the skeletal chain. So for people that have an abnormal arch and may be in need of an orthopedic insert or a podiatrist referral, this could be a structural cause of shin splints. And then muscular fatigue is another one. So this is one where we look and say, like, yeah, maybe a deconditioned athlete or a conditioned an athlete that's in shape physiologically, but not used to the training surface. And a quick example I'll give is maybe a football athlete who at the end of football season then is dual sport and they play basketball as well. And when they go from the football turf or grass to the basketball court, suddenly they get shin splints or this shin pain that maybe they haven't had since, early preseason August when they felt it during football. So that would be a training surface issue. And then the last one there I put in was overtraining, sometimes in distance runners or even athletes that just are very, very active or don't implement proper rest into their training programs. They'll develop shin splints that can even lead to stress reactions or stress fractures if they're not careful. So overtraining can also be a cause of shin pain. So our main focus with rehabilitation of shin splints is we want to lengthen the tight posterior musculature. So that can be done dynamically, static, or ballistic stretch. But more often than not, the first go-to is going to be static stretching, hold for 30 to 45 seconds or 45 seconds to a minute. And a lot of sessions. Some people want to just stretch once a day and they think it's going to go away, which it won't. You're on your feet a lot during the day, and athletes especially are not only on their feet but training for 2 to 3 hour practices and games. So 5 sessions a day until the pain resolves is my recommendation. So, I give the quick example of, when you wake up, before practice, after practice, and before you go to bed, there's 4 sessions right there that are pretty easy to find and make time for. And then throughout the day, try and make maybe a lunch period or something like that, make time to do it one more time for the total of 5. Strengthening. There are many forms of strengthening, but basically you can do it isometrically or isotonically. And I'm going to do a follow-up video that includes kind of videos and kind of a better depiction of some of these exercises. This one is strictly just to get the educational content out there. But definitely it could be done with manual resistance. It could be done in a weight room scenario with plate-loaded machines, more of a sports medicine clinic or an athletic training facility with elastic band resistance, things of that nature. So this is our main focus for rehabilitation of shin splints. The next one is basically conditioning or conditioning that specific tissue. That's not to be lost in the overall conditioning of the athlete. This is simply speaking to the conditioning of the shin or lower leg tissue. So basically, we want to focus on a lower leg anatomy with higher repetitions in the weight room and the athletic training facility. The home exercise program that I would prescribe for an athlete or patient with shin pain would be to focus on flexibility, strength, and conditioning throughout the season and off season. That's really important when we're trying to phase into the next point, which is prevention. Obviously, anytime we can prevent shin splints, that's the best form of treating shin splints. So I'll usually look to insert certain things into the daily activities of these athletes. So, for example, toe walking and heel walking within the dynamic warm-up is a way to kind of target that tissue. They always do a dynamic warm-up before games, before competitions, before almost every day, even on rest days. So the toe walking, the heel walking is something that we can do to condition that tissue, stress that tissue in a positive manner every day. And then the other one that I like to put here is to increase body mass gradually. Each sport is different for sure, but big body weight changes one way, whether it's adipose tissue or whether it's lean muscle mass or external loads. Definitely try and condition them gradually, increase it gradually, and allow the body to acclimate to that additional force. So in this case, it would be continue to play sport-specific games and exercises during periodizations in the weight room that are designed to increase muscle mass. So I'll use football as an example, but it's basically if we're trying to, put on lean muscle mass size throughout the spring and throughout the summer to get ready for a fall, traditionally a fall season. Make sure that you're still kind of doing some conditioning drills and longer distance drills designed to almost get the body or the whole skeleton used to carrying that new muscle mass or new weight. Okay. Self-treatment, right? So not everyone's an athlete. Not everyone has access to sports medicine care. Medication, I'm not against it. It's not my first go-to, but used in conjunction with therapeutic exercises can be really helpful. So you've got your NSAIDs or your non-steroidal anti-inflammatory drugs, your Aleve, Motrin's, ibuprofen, so over-the-counter medication. Just be sure to take them consistently and with thought. Don't just pop a bunch of pills and expect results. make sure it's consistent. So it's either 400 to 600 milligrams 3 times a day for 7 to 10 days, or have a thought in mind and have a reason for taking the Aleve or the Motrin. Just and it's a way to better control your results as well, to see if it's working or not working. Topical analgesics, your biofreezes, atomic bombs, Flexol, things of that nature, are good for pain modulation, but they won't do anything to really affect your healing of the tissue. It will just help with kind of numb the pain a little bit, which at certain times is perfectly fine if it's maybe just game day or just for your longer runs or something of that nature. As long as you're doing all the other right things in conjunction with it, I'm not totally against your topical analgesics. And then in the same frame of mind, your dermatological patches, so your lidocaines, your Flexerils, even some of the prescribed patches that are meant to kind of be transcutaneous and go through the skin to the tissue below. So a couple of myths that I'd like to try and debunk here. The myth one is taping shin splints or taping my ankles or your ankles will heal your shin splints. That's clearly false. It limits the range of motion, and so sometimes takes you out of the painful arc. So you think your shin splints feel better, or you think it feels improved. But basically, my expression is you're putting a Band-Aid on a puncture wound. If you have a puncture wound and you just kind of put a little Band-Aid over it, you're still bleeding underneath there. You haven't done anything to actually treat the condition. You've just kind of are treating the symptoms. And the next one is the myth of the compression sleeves will provide shin splint relief. Those are really done by the marketing companies. They're backed by little to no research. Any of the findings don't really have clinical significance, so they're not like 95% accurate. So I would just say that's more of a marketing ploy, and to save your money on that. And then the third one is basically someone says, I won't rehab, I'll just play through the pain. And while that's admirable, the body is eliciting a pain response for a reason. So sometimes if you don't address that underlying issue and you maintain tight posterior musculature and weak anterior structures, that force has to go somewhere, and that force usually will go to the bone. And so you can begin to develop stress reactions and stress fractures, which obviously will put you on the shelf as an athlete for a while, somewhere between your 6 to 12 weeks, and kind of holds you out of doing the sport that you love to do and the activity that you like to do, even if you're a hiker or in the military or anything like that. Whereas if you had just kind of done the right steps and taken some of the proactive care, you may have been able to kind of get rid of the pain or lessen the pain and actually go on the path towards healing, which is obviously what we want to do. So these are just some closing remarks, but basically that's a quick, hopefully short, hopefully you're still here near the end, reasons for shin splints and healing and treating shin pain. I'm going to follow this video up with actual video of the exercises that you guys can do, and then I'll link this one. So basically, if you're still here, why wouldn't you subscribe, right? I'm going to try and churn out some more videos, try and get some content out there for you guys. And obviously, if you have any questions or any comments, just leave them below, and I'll be sure to try and get back to you guys. All right, thanks for watching.